Well, good evening, and I'd first like to thank the town of Oxford for hosting this forum this evening. I recently did one at Griffin Hospital, and Sue approached me right after that and said, we need to do one in Oxford. I've been working on this for a few years now. I'm a nurse practitioner by trade, and it came out that we're having all these deaths in heroin and opioid overprescribing, and it was something that really struck me because no one really knew what was going on in the state, and we needed to act fast.
Not only in Connecticut, it's nationwide that we're seeing the heroin epidemic. Our data is showing us that in 2015, we had approximately 720 deaths from overdoses of heroin and opioids. And in 2012, it was only 87. Last year, we did a lot of legislation and reestablished the Alcohol and Drug Policy Council. It's been meeting throughout this past year. And currently in this legislation, it's to expand the task force. I believe there's over 20 people on this council right now, and it's a very broad spectrum of representatives. People like pharmacists out there, the first responders, the police chiefs, people that are seeing this every day. We're not all the experts here, and we want to hear from people. So I'm very happy to support this part with expanding our council to have the work groups.
I just wrapped up a roundtable with my good friend, State Representative Teresa Conroy, talking about the work that we need to do to combat this opioid heroin epidemic that is sweeping the valley and the state. We're on track for over 800 overdose deaths this year. That's unacceptable. This is a crisis that needs to be addressed. And Teresa, of course, has been the leader on this issue in Hartford. She took the initiative to crack down on the overprescription of pain medication, which is really the root of the evil here. I'm really pitching for the federal government to step in with some new resources as well. We've also got to be putting a lot more emphasis on our schools, a lot more emphasis on prevention, essentially doing for prescription painkillers and opioids what we did for smoking, just making kids understand how dangerous this is, making it socially unacceptable to be trading pills in schools. So we had a great roundtable with police officers, U.S. Attorney's Office, providers, Griffin Hospital, Yale. I've got some new ideas that I'm going to go work on. I'm just so grateful to have Teresa as a just an amazing partner. The Valley should be really excited to have, really the state's leader on this issue of stopping opioid abuse as their representative.
There's a day that I would like to see that every piece of this Narcan that's out there is expiring on the shelf before we could ever get to using it.